from the Toronto Star. I'm Saba Eitizaz, and this matters. Think of it this way. During the first few days in coronavirus lockdown, you might have thought you had the opportunity to do the things in the house you were quite enthusiastic about. Maybe you binge-watched Game of Thrones or Tiger King, or perhaps you finally got around to building that cardboard box fort with your child. But that was several weeks ago. Now your children might be driving you nuts, you're all Netflixed out, and like me, you just wanted to stop. You are not alone.
Let's remember to take care of ourselves and of each other. Let's remember that it's okay to ask for help and to feel sad and frustrated and alone. We are all in this together. And while we do need to practice physical distancing, we don't have to suffer alone.
As Deputy Prime Minister Chrystia Freeland says, there is help out there as we begin to pay the mental price of COVID-19. The federal government has announced millions for virtual mental health help for those in need. Stress, anxiety, and depression. The impact of the coronavirus is threatening an echo pandemic, a mental crisis looming over the actual pandemic as Canadians across the country struggle to cope.
We are seeing a surge in the number of people seeking mental health support in Toronto, especially among seniors, children, and racialized individuals.
According to recent surveys, that's more than half of all Canadians saying their mental health has worsened over the past 2 months. One survey released earlier this month found that Canada's self-reported depression rate has more than doubled, and the percentage of Canadians reporting high levels of anxiety has quadrupled. Experts warn that these problems could get even worse as it begins to hit Canadians that this year will bring a summer unlike any other.
What I think we're facing here is a very traumatic event for a lot of people. It's a traumatic societal event for people. And one thing that we know about trauma is that while it's happening, you do whatever you can do to survive. I think that we're still very much in the trauma phase, the active trauma phase of this pandemic.
In today's episode of This Matters, we talk to two experts who researched the mental health impact of quarantine during the SARS epidemic about how we can get through this safely, cope with the depression and the anxiety, and whether Canada is ready to deal with the long-term consequences of COVID-19 and an impending mental health crisis. Dr. Laura Hawryluck is Associate Professor of Critical Care at the University of Toronto. She's also an attending physician at Toronto Western Hospital. Dr. Rima Styra is Associate Professor of Psychiatry at U of T. Both of them published a joint research from the frontlines on the effects of quarantine in Ontario during the SARS epidemic. Thank you, ladies, for joining me.
Thank you, Saba.
So I'm going to start with you, Laura. Now, both of you have researched the mental health impacts of quarantine during the 2003 SARS crisis. What are the mitigating circumstances during a pandemic, quarantine, and self-isolation? What did you observe from your time in the field?
During the SARS outbreak in Toronto, we got interested in looking at the psychological effects of quarantine. And in our study, which Dr. Styra will speak to in more detail, some of the mitigating effects that really struck us was the need for consistent, accurate, and regular information. And if that information changed, the rationale behind those changes, because without that, then there was a lot of speculation, there was a lot of misinformation. Information was coming from a variety of different sources, and some of it was conflicting, and people didn't really know what was reliable, what was accurate, and who to trust. And that who to trust really became important in mitigating the psychological impacts that we observed. The other things were that if somebody got sick, they wanted to know who was going to look after them, how would they connect with the healthcare system again, what to expect. And that too, in terms of information, was also somewhat conflicted at that time. And we understood the need for really regular, consistent updates as to that too, because that may also evolve during an outbreak or during the pandemic that we're in, as healthcare systems set up different structures to better fit the needs of people who, are calling and need that kind of help.
Rima, I want to bring you in here. What are the psychological effects that you observed of quarantine or self-isolation? I know that in your studies, you link this to PTSD as well. Can you tell us more? What are the symptoms and how does this work collectively?
So in our study, basically what we found was that about a third of the people who responded to our survey actually developed post-traumatic stress symptoms. So that doesn't mean that they developed post-traumatic stress disorder, the full disorder, but they had symptoms of post-traumatic stress. And I think what's important about knowing about post-traumatic stress is the fact that people often have a cluster of symptoms. So people will identify things such as feeling depressed, anxious, frustrated, irritable, angry. They become a lot more hypervigilant of their surroundings. They develop a negative perception of the future. They see the world as really an unsafe place. They're not sure about the future. They often have difficulty with sleep because they have intrusive dreams. They have difficulty falling asleep, staying asleep. So there's a real combination of post-traumatic stress symptoms and depression that come into play. And since the new DSM-5 diagnostic categories, depression has been also incorporated into the cognitive and mood aspects of post-traumatic stress disorder. We also found in our population, when we follow them for the quarantine, that they develop symptoms of depressive disorders.
Laura, how does the COVID-19 crisis sort of compare to SARS? That seemed to have some clear defined stages. The disease was contained within a few months. There was an outbreak. People's lives were disrupted temporarily, and then things went back to normal. This is a different, more long-standing and unprecedented situation, isn't it?
It is very much so. I think the thing that people need to remember during SARS is that we actually had 2 periods of quarantine. And I think it's important as we enter this next phase of COVID-19 to understand the effects of that second wave of when people had to go back into quarantine or new people had to go into quarantine. So COVID-19, what makes it really different is the scale of the self-isolation that we are seeing. As we get longer and longer into periods of self-isolation, what our study had suggested was that the longer that the state goes on, the more those symptoms become prominent. And, I think what we have seen from people's descriptions, whether on social media or media, of what they've been experiencing, plus some of the new surveys that have come out, we see that these psychological effects are taking a bigger and bigger toll as time goes on, with a lot of Canadians feeling isolated, depressed, alone, and having PTSD symptomatology. Because there's no clear end in sight of COVID-19, and because no one knows how this virus is going to behave, as restrictions start to ease, people are feeling, I think, relieved somewhat. And my concern is that relief is getting mixed in with a lot of joy, which is understandable. If we head to back into self-isolation because the numbers start to rise again, that impact psychologically on what people will then go through is one of the big worries that I have, that it'll be even worse if there's a second period of self-isolation that follows, depending on what happens as we reopen.
Laura, I'm going to get into more detail regarding that sort of sense of optimism that people might be feeling at this point. But first of all, I want to talk to Rima. You guys mentioned the role that uncertainty plays in all of this, just not knowing when this will end and how normal will look like for us on the other side. How do we mentally prepare for more COVID-19 uncertainty?
Difficult question, because I think none of us really know the answers to that. I think our experience with SARS, as Laura mentioned, has really been a totally different kind of experience. It was much more short-lived. I think one of the things that we need to do right now is accept the fact that normal is never going to be normal again, and that we're going to have different kinds of parameters that we live by. One of the things that I think is going to be happening is that we're going to feel a sense of relief that Dr. Hawryluck was talking about, the fact that, as we restart the economy, as things start to kind of move towards a more acceptable interaction between people, people will have a sense of relief. But even as that occurs, there's going to be fear and worry for all of us, because social distancing was something that gave us a sense of control over COVID-19. we felt by social distancing, we were actually starting to flatten the curve, that we were in many ways protecting ourselves and protecting our loved ones from getting COVID-19. So as that's taken away from us, and should we have the reoccurrence of another wave of COVID-19, it's going to be another trauma that's going to be added on to what we've already been experiencing. So I think we have to really try and temper our enthusiasm for a return to what we would tend to think is going to be the new normal. I think we're going to have to be very guarded. We're going to have to actually temper our expectations of what this new normal is going to look like. We're going to have to realize that we're going to have to take it very slow. It's going to be small steps in terms of returning to that state. We're going to have to think about things such as altruism. We're going to have to think about things such as compassion to ourselves and to others. We're going to think about basically being kind as a society. And I think one of those things is going to be the fact that we're going to have to also support each other, because there are going to be many amongst us that are going to have a much more difficult time than others. And that's going to be a lot of the role for mental health resources in terms of providing support for those people who will also be much more vulnerable to the effects. So I'm thinking about groups such as those who already have mental health issues prior to COVID-19, some of the groups that are very much more isolated, that aren't able to use some of the resources that some of the younger individuals can, such as video conferencing, Skyping, FaceTime. I'm thinking a little bit more about the elderly population here who might be as familiar with technology and have actually been much more isolated from their family and friends because of that. And then thinking about the people who will have lost individuals during this whole COVID-19 pandemic. Those are going to be people who are going to be extremely vulnerable to the grief and the sadness that will occur as time goes on, and they can process things a little bit more and they start to sort of grieve. And sometimes there's also that whole aspect of survivor guilt, especially if it's occurred within a family and some members survive and others do not. And guilt as to where the COVID-19 might have come in. Was it brought in by a family member? Was it a friend? Was it an acquaintance? So lots of things that are going to have to be processed in the future. But I think the one thing that we can do is be kind, realize that we're all in it together and that we need to support each other.
That actually ties into this recent survey that was published this week, which found that half of all people who were surveyed said that their mental health has worsened over the past month and a half. And experts are talking about an echo pandemic of continued mental health issues following this crisis. Is this likely, and do we need a long-term plan to address this? We know that the government is already investing some funds, but do we have to look at this in a bigger picture sort of scenario?
In terms of looking at the long-term, some of the things that I would tend to think that have been extremely positive, let's say from COVID-19, is the fact that there's been increased use of telehealth. So prior to this, telehealth was something that was used in the medical profession and in mental health, but not to the extent that it's being used right now. So what's actually happening is that both patients and the clinicians, counselors are getting much more used to the use of telehealth to provide mental health resources to their patients. This is actually a positive thing that's occurred. And I think it's going to be something that's going to continue after COVID-19, basically. It's going to be a new way of delivering mental health resources to people who previously were not able to access any kind of mental health support. So that's a positive aspect to that. I think we've got to think about long term in terms of those who have more severe mental health issues that might not actually have access to the technology or sometimes might be a little bit more resistant to utilizing that technology. So these are individuals who will really need a lot more support as we continue to have this new normal that we talk about. I think the government has invested approximately $12 million in cognitive behavioral therapy, which is going to be online, which is another positive, which will probably provide a lot of resources, but I think we're going to continue to need more resources for individuals. Easy access to mental health is important. We know that already the system was overwhelmed, but if we see large numbers of increased need, I think we're going to have to kind of ramp up our system to be much more cognizant of the fact that there is such a high need out there.
Laura, we're seeing a lot of people getting out there recently. I've seen public spaces quite crowded, and it seems like people have run out of things to do, staying at home. They're also getting a lot of optimistic messages from the government regarding the situation. Is this part of what they call quarantine fatigue and also a lot of optimism regarding where we're at with this pandemic? What is the reason behind this behavior, and what are your concerns? I know you mentioned them earlier.
Yeah, I think it's only normal. I think, a lot of us are optimistic by nature, and a lot of us can deal with real hardships for, some period of time. But there's always this sort of sense that, maybe we should try to look for silver linings to get us through, and sometimes it's hard, especially when those silver linings don't actually exist. So I think as we get through this period of time and we start to see some reopening and some light at the end of the tunnel, I think the other thing that's sort of come into play is that the numbers have not hit the projected numbers of people who became ill, who became hospitalized, and who did not survive the COVID-19. And that is a result of all of these measures of social distancing and that have taken place. But knowing that those numbers are a lot better than what we were originally predicting, I think that also feeds into that feeling of optimism. And so as we get closer to the point where the government is going to release restrictions, I think people are already starting to ease some of the restrictions that they had put themselves under. I think we know that we've got to get back to some semblance of open society. And how we do that, we just need to remember to be cautious. And we need to keep an eye on what we know about this virus, what we don't know, and how we're closing that gap. That really becomes important as we move forward, because that will help us take steps forward more safely, more carefully, and more rationally than perhaps if we were more driven by emotions, only emotions, in terms of that joy of freedom from our houses and freedom to meet up with family and friends. Without that information, we were going to be in more trouble in terms of a potential relapse and a re-escalation of numbers of people who get sick. We have to temper, as Dr. Styra has said, what our expectations are in the near future and how long this period of near future may last before maybe we can take some further steps to get closer to where we were before this virus entered our worlds.
Do you think that the government restrictions sort of brought a psychological barrier along with them for people to be more cautious, to stay at home more, and now that they're slowly being eased, do you think that's something that could be a cause for concern? People might feel too optimistic too early, for example.
I think they might feel too optimistic too early for the reasons of us not seeing the numbers that were originally predicted, for us not seeing the duration that was originally predicted, even though this has still felt like a very long time for so many of us. And I think that those two factors alone, people are going to want to search out those freedoms faster without any restrictions that the government is going to want to put on. So the concept of potentially wearing masks and stuff in public, or still maintaining social distancing, not fully opening, being very selective about what businesses open and when. There's going to be a lot of push to open faster than what our governments are going to be prepared to do in their efforts to keep us safe. And I think that's where the concepts of really being patient, still being understanding, still trying to understand how the government is making decisions and why, that kind of information can help us get through this period and set reasonable goals for ourselves and how we interact with others. But I go back to that importance of information, because I think, whatever we do as we reopen, it has to be very clearly communicated, and people need to understand why, and they need to still listen to why. This isn't over yet.
And Rima, what do you think will be the psychological impact of slowly emerging from this situation eventually? For example, of having to wear masks or not being able to see faces. There will still be fear of infection, and we will need to clamp down again if there are surges again.
I think it's going to have a major effect on people because one of the things that we know is that human beings are social by nature. We basically enjoy socializing, and we actually really depend on facial expressions. Part of the reason probably why all of the technology has been very helpful nowadays is because people enjoy seeing the other individual, they see the reactions. The mask is going to be hiding a large part of the face, and that's an uncomfortable kind of process for us here in North America. It's not been something that we've been used to. It's going to continue to distance people. They're going to feel a lot more hesitant probably about some interactions when all of a sudden they can't kind of recognize the individual. So in our hospital, I'm just going to use the example where people are wearing masks and face shields. Some of the staff have said, people will say hi to me and I don't actually know who it is, because we can't connect the face as much any longer. So there's this distancing that's going to occur, this sort of sense of feeling a lot more isolated and a lot more alone, even though we're starting to return to a normal. I think that part of that is also going to lead to the fact that people are going to kind of think about what has happened to them and many of the changes that have occurred in society. So for people who have lost jobs, economic pressures, especially if you've also known someone who had COVID-19 and they didn't fare well, you're going to be you're going to be extremely anxious, you're going to feel hyper vigilant when you're out there, you're going to be constantly aware of the fact that someone might cough. What does that mean? They're not looking well. We're going to feel that we're in a little bit more of a danger zone. And when you start talking about being in danger zones, you start thinking about, again, the trauma, the hypervigilance, more of the post-traumatic stress symptoms that we talked about. I think one of the most important things for us to realize is that if we're starting as this kind of move to normal starts, what we need to think about is, how are we feeling? And if we're starting to feel symptoms that we're becoming a little bit more concerned about, we're more tearful, we're more anxious, maybe those are times that we should actually be reaching out early on to get some mental health support. And that's where our mental health resources are going to come into play.
I want to add a couple of things, Saba. So I think the other thing to remember is that a lot of our communication is actually nonverbal. So we rely not only on the words that are spoken, but how they are spoken, how somebody's facial expressions are, how they're sitting, what they're doing. That makes up a lot of communication. And so to Dr. Styra's point, when we don't have that anymore, it becomes a lot harder to be supportive of each other, a lot harder to convey that understanding that we're all going to need when we move forward, because it's going to be important that we're all gentle with ourselves, but also with each other. And I think the other thing that is really important to understand is that a lot of us will never have had psychological effects like this before. And it's important to understand that it's okay to be feeling some of these things and to need help if that's what you need. There should be no stigma, difficulty to understand that it is okay to reach out. I think that message is really important. And sometimes as we start back, even people who run small businesses, who have to figure out their plan moving forward, this can be a very frightening time, and one that is extremely high in stress, perhaps even more stress than they've ever experienced in the history of their business. And it's okay to seek out some help to get through that. And it's important that people understand that others who have never needed this kind of help before may need this help now.
Dr. Hawryluck, Dr. Styra, you've been very kind with your time. Thank you for being on our podcast.
Thank you, Saba.
Thank you.
As the doctor said, there are resources available. If you need to hear a voice on the other end of the line, 4 Counties Crisis offers 24 hours free confidential support at 705-745-6484. If you prefer to communicate your thoughts virtually, you can text Distress and Crisis Ontario at 258-258 between 2 p.m. and 2 a.m. Or text CONNECT to 686868 to Kids Help Phone, which also serves adults. And you can always call 211 to find other mental health supports across Ontario. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Muther. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.